Hello, everyone. My name is Steia Williams, and my topic is the impact of depression on memory. So, really quickly, some brief pointers about my vignette is that it's an outpatient group and community center for 8 teenagers, and it's focused on their resilience. It's mixed in race. They're between the ages of 12 and 16 years old. Some of them have been diagnosed with ADHD, anxiety, depression, and some childhood trauma as well. So specifically, I have listed here in detail about the characteristics of depression, but more so specifically, we're interested in how it alters cognition. So because of the deficits in concentration and information processing and attention and memory, we have what is developed, such as a cognitive bias. So that's basically any error in thinking that happens when someone is processing and storing and interpreting information. Specifically related to my vignette, it's teenagers, and teenagers are at the developmental age where they're more likely to think negative of themselves. They're more self-conscious, more under the pressures of social norms and, with their peers, with their family and academics as well. And so sometimes we also have what's called a memory recall bias. And that means we often omit details or we're unable to remember events accurately. But specifically, people with depression are more likely to recall events that are consistent with their emotions. So it's easier to retrieve that memory when it's tied with something negative because they are experiencing depression. So ultimately, depression interferes with the interpretation of stimuli and also the processing of it. So when depressed patients are presented with something neutral or a neutral event, they're more likely to prime and look for those negative themes that are associated with depression. So what that means is for these teenagers that are in this group, because they're more prone to think negatively or realign themselves and ruminate probably over negative events that may have happened, we want to focus on what is called some CBT skills that they can do in a skill setting, looking at mood monitoring, self-regulation, maybe some relaxation techniques, ways to communicate their emotions and their feelings, and also problem solving as well. So that's a majority of bulk of what my poster is about. Feel free to take a look and just check it out.